What are you working on?
It doesn't matter what I'm working on. I'm asking you, what are you doing here taking pictures?
Where have you been today? Have you been here all day, or have you been out and about a little bit?
What is this about? Who are you?
I'm asking the questions. Where have you been today?
No,
have you been here?
I'm asking the questions. You're on this property. You're on this property, so you need to answer my questions.
Are you drunk? Why are you slurring your words today? So have you been here all day, or have you been out? Have you been to the bar today at all?
Who are you?
Have you been to the bar today?
Who are you?
I'm an investigator.
Investigator for who?
Investigative journalist.
The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread. On Tuesday, we will be finalizing these plans and providing a summary of our findings, supporting data, and strategy to the American people. So we'll be having lots of meetings in between, but we'll be having a very important statement made on Tuesday, probably Tuesday evening, on all of the findings, all of the data, and the reasons we're doing things the way we're doing them. We can expect that by June 1st, we will be well on our way to recovery. We think by June 1st, a lot of great things will be happening.
Yep, we are being restricted for at least another month until April 30th, and the federal government will be releasing these plans today. Isn't it right now so convenient that your state government, being coerced by the federal government, can in a snap tell you you can't go to your job, your business can't be open, and you are severely limited in where you can go? This is seriously about as close as you can get to martial law, which America has never entered in the modern time, and was only issued once by Abraham Lincoln during the Civil War. Although this isn't about a war with people, this is about another type of enemy. Why do you think Trump is talking about this like a war?
I want to assure the American people that we're doing everything we can each day to confront and ultimately defeat this horrible, invisible enemy. We're at war. In a true sense, we're at war. And we're fighting an invisible enemy. Think of that. So it cost me billions of dollars to be president. And I am so happy I did it. Because who cares? Who cares? I'm really happy with the job we're doing. And I'm glad that this team and me are here for this horrible thing. I mean, it's a number of people have said it. And I feel it, actually. I'm a wartime president. This is a war. This is a war, different kind of a war than we've ever had.
Yeah, the only way to issue in martial law, aka military law, is when you have an enemy to fight. And this enemy is invisible, based on health and disease. So they are issuing in a concept called medical martial law, which is a whole hell of a lot easier than staging a physical enemy like those terrorizers.
We must stop the terror. I call upon all nations to do everything they can to stop these terrorist killers. Thank you. Now watch this drive.
Good old W, our presidente during a time when the terrorists were people, but now they are so small, microscopic, and downright infectious, we have to take even more drastic measures than what happened after 9/11. And by drastic, I mean we haven't even seen the bulk of them. They are still to come. So what could those measures be? Well, you can't just take away people's full civil liberties in a really quick snap. You gotta do it slowly but surely. So let's see what civil liberties are currently being stripped. Florida and Miami, they have an official curfew. Last week, they announced a citywide shutdown from the hours of 10 p.m. to 5 a.m. And this curfew is strictly enforced by the Miami Police Department, as seen from the article. And this spread to other cities in South Florida, as Homestead and Coral Gables issued similar ones later in the week. We also saw Southwest Georgia issue similar ones, as their police enforced curfews for multiple cities and counties across the state. So literally, in parts of America right now, you can get arrested for going out at night. Civil liberty gone. And those in cities or counties where it was enacted, I'm sure the people are getting quite used to it. programmed to be a-okay with having a curfew. Although a majority of us are complying with a curfew without even having a curfew enforced. The only reason to go out at night beyond your home is to socialize. And what is our country pushing like never before? Social distancing. Let's just watch this PSA put out last week regarding top American officials' recommendations for the coronavirus.
Social distancing is what we refer to when we ask people to stay at least 6 feet apart.
Staying away from people whom you might get coronavirus from, or who are at high risk and whom you might spread coronavirus to.
You can socially distance yourself from people in social settings by not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
Yeah, that was put out by the CDC, and now it's time for Chico to freak you out a bit. So you remember the movie Contagion? I'm sure most of you have watched it since the coronavirus outbreak. Well, did you really watch it? Because I am certain that was Hollywood doing some predictive programming. This is just too freaking weird. Viral pandemic, which begins near China, is a variation of SARS and comes from a bat in the movie. Yeah, so similar to the coronavirus, right? Well, let's just watch this clip from it now.
Alan, today on Twitter, you wrote that the truth about this virus is being kept from the world by the CDC, by the World Health Organization, to allow friends of the current administration to benefit from it, both financially and physically.
There are therapies we know are effective right now, like forsythia, and they don't even appear on the CDC website.
Yeah, there's a herbal treatment in the movie called forsythia, which when I first watched the movie, I thought it was just a made-up name. But forsythia is a real plant in real life. And guess frickin' what? They are using this plant in China right now as an alternative treatment for coronavirus. This research by the Chinese Journal of Integrative Medicine, titled Can Chinese Medicine Be Used for Prevention of Coronavirus Disease 2019, shows us, yes they are. As we can see, Forsythia fructis is one of the ingredients in the list of herbs being trialed. Need more? Well, the Shanghai Institute of Materia Medica, SIM, and the Wuhan Institute of Virology found that Shuanghuanglian oral liquid could be used to inhibit the 2019 nCoV. From the article, what is this oral liquid made from? A blend of honeysuckle, Chinese skullcap, and forsythia. Now my friends, SIM is run under the Chinese Academy of Sciences, which is state-owned and run, so this is no BS. And the news in China was broke by the official state-run press agency of the People's Republic of China, the Xinhua News Agency. And it caused people to panic and rush to pharmacies to get the oral liquid. Weibo has been covering this like mad, and has a video that was posted of the long lines. Let's just watch side by side what is going on with the Shuanghuanglian and a clip from Contagion, people waiting for forsythia. Yes, so many damn similarities. Even back then, bats, respiratory virus, starting in China, forsythia. But now we have to go back to a clip from Contagion with the CDC director Lawrence Fishburne and a media news reporter. Let's watch now.
But right now, our best defense has been social distancing. No handshaking, staying home when you're sick, washing your hands frequently.
Yes, he is exclaiming, just like now, social distancing is what works. Lawrence Fishburne, the CDC director. But there is a person he is talking to, the news station reporter. Who is that? Well, that is no other than a person in real life who is now on CNN almost 10 years later doing the same thing as their chief medical correspondent.
You look at these extraordinary measures that are taking place in China, the largest quarantine in the history of the world, the policies, the travel restrictions, all of that, they say, was really designed to slow this down, not stop it. It's a tiny little virus. It doesn't respect boundaries and borders. You know, I talked to Dr. Redfield, who's the head of the CDC.
Yup, talking to the CDC director, informing the American public, putting them side by side. It's the same damn guy from the movie doing the same damn thing. So right then and there, I was like, what the freaking freak? And it made me realize that Contagion might just be a bit more dramatic version of what is to come from this. What was a major theme in that movie? The vaccine. Yes, as the virus becomes more deadly, a vaccine is all the population can think of in the movie. The death toll reaches 2.5 million people in the US and over 26 million people worldwide in the movie. Would you get a vaccine if things were like that right now? Well, as of right now, not in the movies, the death toll is still under 40,000. But dying from the virus is becoming a very common theme in mainstream media. Why do you think it was announced Sunday the death toll here in the US could reach 100K to 200K by the head of the task force, Dr. Deborah Birx?
So we've never really done all of these things that we're doing. We've put them into a model. We've looked at the Italy data with their self-isolation, and that's where we come up with, if we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities. We don't even want to see that.
I know, but you know, you kind of take my breath away with that, because what I hear you saying is that's sort of the best case scenario. If everything works and people do the things you're asking them to do, maybe you can hold the deaths to 100,000 to 200,000 in this country.
And yeah, that is the best case scenario. What is the worst case scenario? Well, Trumper told us as he talked with Fox News just yesterday regarding the death briefing with Dr. Deborah Birx and Dr. Fauci. Let's hear now.
In one day, we had to shut it down. And by the way, I don't know if you saw yesterday, but the question I've been asking, a lot of people have been asking, if we didn't shut it down, because I used to say, a lot of people said, well, could you just have kept it going? You know, like the flu, like a bad case of the flu, a really bad case. And the answer came in yesterday through Dr. Fauci and through Deborah Birx. The answer came in, if we did that. In other words, if we just kept the business as usual and didn't do anything to stop it or impede it, could have been 2.2 million people could have died. 2.2 million people.
Yep, 2.2 million in the US is a worst case scenario, which is so close to the 2.5 million US casualties in Contagion. If deaths start to ramp up and a vaccine is created, are we going to be scrambling to get it? Well, that looks how things are going to be playing out. And if you kindly tuned into my live stream over the weekend, you know exactly what this leads into. ID2020 and their global ID and vaccination program. Going to ID2020's website, it's obvious they are gung-ho on creating a global ID. But their alliance is important. Who is behind ID2020? As we can see, Accenture, Microsoft, the Rockefeller Foundation, and Gavi, the Vaccine Alliance. Who is behind Gavi? Of course, Bill and Melinda Gates, as they set it up in 1999 with a $750 million donation. And who just stepped down from Microsoft to focus on philanthropy? Bill frickin' Gates did. And in a Reddit AMA posted 13 days ago, he leaked what he was working on. A user asked, what changes are we going to have to make to how businesses operate to maintain our economy while providing social distancing? Which he answers, but in the paragraph below he drops this for some reason. Eventually we will have some digital certificates to show who has recovered or been tested recently, or when we have a vaccine, who has received it. Yep, it's coming, a digital health certificate based on coronavirus testing and vaccination information. And why do you think ID2020 announced just before the outbreak in September of 2019 this? ID2020 and partners launch a program to provide digital ID with vaccines. Could this be the digital certificates he was speaking about in vaccines? Well, if they are digital, untamperable, you would think they would be on a blockchain, right? Well, from my research, you are correct. Over the weekend, MiPasa was announced, which doesn't that sound like MyPass in Spanish? Yeah, it does. So what is MiPasa? According to their website, it's a global scale control and communication system that enables a swift and more precise early detection of COVID-19 carriers and infection hotspots through seamless and fully private information sharing between individuals, state authorities, and health institutions, such as hospitals and HMOs, utilizing advanced technological tools and a dedicated user app. But who is involved? Microsoft, IBM, Oracle, Hasera, the World Health Organization, and countries around the globe. The US CDC, the Chinese CDC, the European CDC, and more. MiPasa tu casa, MyPass your house. Yeah, MyPass is coming to your house soon. So remember ID2020? Well, they already have a program out there in the English version of MiPasa called, yes, MyPass. They rolled it out here in the States, Austin, Texas, in 2018. And as we can see from the website, it's a blockchain-enabled platform that stores, secures, validates, and automatically packages personal documents, facilitating resident access to social and health services, especially vital to ending homelessness, such as housing benefits and access to medical care. And at the bottom of this, we are excited to continue working with the Austin community, as well as partners like ID2020 in helping our neighbors secure their identity and access to services they need. So, super scary? Yeah, it is. Now let's just go back to MiPasa and actually the blockchain platform that is being named as one of the top contributors, Hasera. One of their products, of which MiPasa is hosted on, is the Unbounded Scale, which is a smart contract abstraction layer built for enterprise, which combines the ease of use of digital assets open source YAML SDK with enterprise-grade Hyperledger Fabric deployment. Connections, connections, connections. So my friends, if you don't see it, a digital ID tracking system, it's being built before our eyes and under most people's noses. The connections between digital asset, Hyperledger, and the EEA makes me think projects I've been talking about, Unibright, Chainlink, and more, might have a seat with the elite in the New World Order. As, if you know, those projects connect right back to DAML smart contracts, digital asset, Microsoft, the EEA, and more. Is that a good thing or is that a bad thing? Bad for our future, but good for our pocket. Well, I'm going to figure this all out if it's the last thing I do, which it might be. Cheers. I'll see you next time.